Bay Area health experts warn we are on the cusp of yet another COVID surge across the country. But the new data shows the highly transmissible Omicron variant may mean our next wave will be much milder. ABC 7 News reporter Stephanie Sierra is live here now with the details. Steph?
Yes, Kristen, in contrast with other waves of COVID, our first early look at the patients hospitalized with Omicron in South Africa shows some promising signs. Cases are milder, they're not in the ICU, and most aren't requiring oxygen. But experts warn that may not necessarily be the case here in the U.S.
There's a lot of fear surrounding the newest highly transmissible Omicron variant. Health experts expect the Bay Area will start seeing the beginning stages of a surge within 2 weeks.
In the Bay Area, I would expect that people will get Omicron. And if they do get it, it'll be very mild, or many people wouldn't even know they have it.
UCSF's Dr. Peter Chin-Hung says preliminary data out of South Africa shows the majority of hospitalized patients are unvaccinated and younger, with 80% under the age of 50. Cases are reported to be milder than Delta, meaning patients aren't in the ICU and most aren't on oxygen.
The fact that they're not requiring oxygen in the hospital is a good sign. It mainly shows that, there isn't a robust bad inflammation that causes the lungs to get all clogged up.
Chin-Hong says this early evidence is a promising sign. Our next surge will likely be mild and not overwhelm our hospital capacity, especially in a highly vaccinated population like the Bay Area. But he also pointed out it's still early and usually takes more than 2 weeks for people to get severely ill. Not to mention, South Africa's population is much younger than the U.S.
And there aren't as many people with comorbidities like in the U.S. It may mean that early initial mild disease that we're seeing so far in South African hospitals may not be the case in the United States, particularly in unvaccinated individuals.
Experts say this is why it's never been more critical to get booster shots, because the next couple months could present a triple threat with the flu, Omicron, and Delta.
I think it's quite possible that Delta and Omicron will coexist together in certain places.
If and when that happens, it's still unclear if the combination will result in more severe disease.
There's nothing stopping a person from getting influenza plus Omicron plus Delta, and that interaction may make people sicker.
Now, it is very possible the conclusions drawn from this data could change, but doctors say either way, an Omicron surge will hit the Bay Area. The question is, will it stay mild or strengthen to overcome Delta? Dr. Chin-Hong says we should know more even in just a couple weeks. Dan?
It'll be an interesting couple of weeks. Steph, thank you so much.